Well, hi everyone, I'm Judy Elliott, and coming up today on Lifestyles for Women, did you know that men as well as women can be diagnosed with breast cancer? Since October is Breast Cancer Awareness Month, we have asked Dr. Kevin Johnson, radiologist for Hamilton Diagnostic Center, to join us to discuss the topics of breast cancer in both men and women. All this coming up today on Lifestyles for Women. We'll be right back. Well, hi everyone, and welcome again to Lifestyles for Women. As we know, October is Breast Cancer Awareness Month, and today we're going to be talking about breast cancer and some of the things we hope that you'll learn from this interview today. My guest today is Dr. Kevin Johnson, and Dr. Johnson is with North Georgia Radiology and works directly with Hamilton Diagnostic Center. And certainly, Dr. Johnson, we appreciate you being here with us today.
Yeah, well, thank you for asking me to come by.
You know, I was just going to say a couple of days ago, I was riding by the Hamilton Diagnostic Center, and I see the silhouettes, the ladies' silhouettes, the pink, pretty silhouettes there in honor of Breast Cancer Awareness Month. But I'll have to say, I noticed the male silhouette as well. Can you tell me a little bit about that?
Yeah, so correct. We added this year in honor of Breast Cancer Awareness Month. Obviously, the month of October, you see a lot of pink and all out, and people are fully aware of female breast cancer. But this year, we want to make people more aware that male breast cancer exists as well,
right.
and try to make them aware of that. I think most people probably know, but I think a lot of people do not. So,
and I think breast cancer became so more familiar at talking about it in discussion as women and breast cancer, but that is it is today. As you said, trying to get more awareness that this also happens with men. Tell me, do you have any statistics for that?
Yeah, so for men, it's basically a 1 in 1,000 is the lifetime risk. In females, it's 1 in 8, and that's what, with our 8 pink silhouettes that we have, we're trying to put that number out in people's heads. So it's much less common in men, but it does obviously happen. It's about 100 times less common in males and females. So for every 100 female cases of breast cancer we'll diagnose 1 male with breast cancer. The American Cancer Society, their estimations for 2014 are that 2,360 men will be diagnosed, and there will be approximately 430 deaths from male breast cancer. So, and males and females begin with, when we're born, we obviously have breast tissue, and those things differentiate with hormonal changes and particularly around puberty. So the ductal system in the male breast is not as well developed. And also, men have less female hormones or estrogen, so that decreases their risk of breast cancer.
I think it's very surprising for people to I guess, know that the statistics are actually rather, I won't say high, but they really kind of are, that for men as well as women. But I mean, you don't really think of men having that high of statistics.
Correct, and I don't think a lot of people know that. So it's, and we do at the Diagnostic Center, we do a fair number of diagnostic workups on male breast. I'd say within the past year, we've probably done 50 or so. We do 40 to 50 screening mammograms probably on a daily basis with females, but the male numbers are, for cancer in general, are relatively high. And I think overall, it's of all the cancers in men, breast cancer represents about 0.2% of those cancers, but obviously it does happen and can be pretty significant.
Right. Do men sometimes could feel a lump, or is the same thing kind of apply?
Yeah, typically it's going to be the same signs and symptoms that the females experience. The big things are, a lump or just swelling in the breast. Typically it's going to be painless. Yeah. You can have skin changes, dimpling or puckering of the skin, nipple inversion, which the nipple actually retracts inward because the cancer can develop behind the nipple and pull the nipple in. And skin changes as well. It can even look like a rash. Some scaling or itching around the nipple is not uncommon. But yeah, typically those same signs and symptoms that females develop.
So if that happens, definitely you should seek the advice of your physician and see, I mean, just don't let it go.
Correct. And the information that's out there on male breast cancer is that they typically wait later. And I don't know if it's more of an embarrassment issue or shot at their masculinity, but they'll come in later. And male breast cancer, unfortunately, because of that, is typically diagnosed later in the disease progression than it is in females.
Very interesting. Well, we're going to take a break here, and we're going to come back in just a few minutes and continue this interview. Very interesting, Dr. Johnson, and if you'll stay with us, we'll love to have you as we continue this important topic. Thank you.
Thank you.
And we'll be right back with you in just a moment. Thanks for joining us back here on Lifestyles for Women. As we continue this interview today, we are talking about breast cancer and breast cancer awareness. And with me is Dr. Kevin Johnson, and with Hamilton Diagnostic Center. I know you work directly with Hamilton Diagnostic Center with North Georgia Radiology. But again, thank you so much for being with us here today.
Yeah, glad to be here. Thank you.
You know, before the break, we were talking about men and breast cancer, and along with this show, we're going to also cover women and breast cancer. But on the subject of men, we talked a little bit about sometimes men are a little bit slower to come in if they have a problem, probably to see their physician and all. But if they should encounter somewhere that's kind of strange looking from the symptoms that you kind of said might happen, or the change of appearance, and they go to their physician and the physician feels that they should have further testing, what happens when they get to you at Hamilton Diagnostic Center, and what happens and how is that tested to see if they possibly might have breast cancer?
So typically we'll start similar to a female breast exam. We'll have them come in. We'll typically start with a mammogram, and we can do, with a screening mammogram in females, we'll do just a 2-view of each breast, so you end up with 4 images typically. And then in a female, for instance, if we see something abnormal on screening, if they develop symptoms between screening mammograms, we'll bring them back in for a diagnostic mammogram. And that's basically where we start with men, because screening mammograms are not performed in men because breast cancer is so uncommon in that population. But we'll typically start with a mammogram. We'll do your standard 2 views. And then oftentimes, depending on what those show us, we can do magnification views where we can blow up that area or get a better view of that area, looking for any suspicious abnormalities on that. And depending on what the mammogram tells us, oftentimes as well, we'll do a ultrasound, focal ultrasound, looking specifically at that particular area of the breast to see what's going on. And then from there, it's the way we have it set up in our practice is if we do see something suspicious or abnormal that we feel needs to be biopsied to determine whether it is a cancer or a benign lesion, we'll refer them to one of the surgical groups in town, and they'll do the biopsy. If it's seen under ultrasound, that can be done in the surgeon's office. If it's calcifications that can't be seen under ultrasound, they'll typically come back to our office, and we have a machine, a stereotactic biopsy machine, where calcifications can be localized, but the breast surgeon comes, into our office to have that done and perform that.
Oh, that's quite extensive, the way that it's really detected. If it is detected, then you have that series of good thorough follow through as you're going through that to make sure that everything is what they're seeing needs attention, or is it something that is just there and it's okay. It kind of helps with that without having all that together to all the doctors to follow up together on. I think
Correct.
That's important, very important. We talked a little bit about sometimes the men are a little bit slower to step forward and say, hey, I do have a problem. In case someone just joined us, can you tell us maybe what they might see, or what changes that they might have in their breasts that would cause them to need attention?
And like we were talking about in the first segment, it's the research does show that men come in with more advanced disease because they delay, either one, they're not aware of male breast cancer, but I think the majority of it's just an embarrassment issue, kind of a shot at their masculinity, and they don't want to, tell anybody they're having breast issues. But again, those signs and symptoms are similar to what you'll see in the female breast. Probably the most common is a lump or asymmetric swelling, which is typically going to be painless. And have overlying skin changes, puckering or dimpling of the skin, nipple changes as well. You can get retraction of the nipple or inversion where the nipple actually turns in. Nipple discharge is another big one I didn't mention in the first segment, but any sort of nipple discharge in a man's obviously abnormal. Bloody discharge is one that you want to particularly look out for. And then even skin rash is another. You can get some itching, redness, scaling around the nipple or the breast where the cancer is actually developing. So any of those are warning signs that need to be looked out for. And if a man does develop those, like females, then they need to alert their primary care physician or whoever they see for their breast issues and go from there.
Right, because as we know, the sooner the better always in any case like this. So for men, don't delay it. If you are having those problems, get it seen about.
No doubt.
So.
And the way the statistics as far as the stage of disease, typically you stage it stage 0 to stage 4. So and the female and male breast statistics are pretty similar. If you catch it in those early stages, stage 0, stage 1, it's typically 100% 5-year survival is what the statistics say. Stage 2, you're at about 90. Stage 3, about 70%, and then stage 4, when you have widespread, metastatic disease, you're talking about a 20% 5-year survival. So that's why it's so important. It's literally the difference in life and death, depending on when you seek treatment.
Right. Very interesting. Well, when we come back from this particular break, we're going to come back and talk more for breast cancer with women. And kind of wrap up the show with that. So again, we appreciate you staying with us here.
Thank you.
And we'll be right back with you in just a moment with Dr. Kevin Johnson. We're going to be talking about breast cancer with women. We'll be right back. Well, hi everyone, I'm Judy Elliott and welcome back again to Lifestyles for Women. As we continue today, we are talking with Dr. Kevin Johnson and Hamilton Diagnostic Center in North Georgia Radiology. Certainly you work very closely with Hamilton Diagnostic Center and helping with all the different types of screening. We are talking about, before the break we were talking about men and breast cancer. And we're moving to women and breast cancer, but I have to ask you a real quick question I should have asked you prior to that break. Is it necessary for men to get regular mammograms?
Not like females. Again, the numbers are so much more uncommon in men. So we're talking about 1 out of 1,000 lifetime risk, where you're talking about 1 in 8 females. So with the men, we'll typically just do diagnostic workups where they present to their physician with their sign or symptom, and then they're referred over to us for further imaging. And the radiation doses in mammogram are very, very low, but anytime we can spare any radiation, we typically do. So when you're talking about a 1 in 1,000 chance, the risk of radiation exposure outweighs any benefit of detecting a breast cancer at that early stage. And radiation is even one potential risk factor for developing breast cancer. It requires much higher doses than you get with just a routine screening mammogram. But the answer to your question is no screening mammogram in men. Okay, great. Now, moving right along with women and breast cancer. I know we've, I think, done a super job with the topic of breast cancer in raising awareness for breast cancer in women. But for a few questions to ask, have the statistics changed for women over the past 10 years? They have not. They've held pretty steady for quite some time now, at least over the past decade. You're still talking, 1 in 8 lifetime risk. The number of new breast cancer diagnoses and deaths related to breast cancer have held pretty stable in women. And like you said, the awareness of female breast cancer has definitely gotten better. I mean, you turn on any sort of sporting event or TV or anything during this time of the year, you see pink everywhere, and everybody, and even our numbers at the diagnostic center go up. I'm not exactly sure how much, but I'd say we probably do 30% more screening exams during the month of October than we do the rest of the year, just because the word gets out there so good and everybody seems to be pretty aware now.
Right, and it's a great way to remember, oh, October, breast cancer awareness, it's time for my mammogram. And that just happens, and that's great that we have got to that point that women know that that's very necessary to have the mammograms. What about the age that women should start getting mammograms? Has that changed, or what seems to be kind of a standard guide?
So typically the guidelines that we'll go by are from the American Cancer Society and then the American College of Radiology. Those are essentially the same. So for just kind of a regular average risk, which most females are going to be, the recommendations still hold that at age 40, annual screening should start, and you should get those once a year until, as long as you're in good health. There's some controversy regarding the upper end of that age scale, but we'll still commonly see, 80 women in their 80s and even their 90s sometimes that come in for their annual screening mammograms that have been getting them for the past 40 plus years. So those recommendations still hold true. That being said, you have to stratify the risk, which should be done in advance of any, most people know what their family history, that's a big one. So if you have a first degree relative, whether that's a mother, sister, or daughter, say a female has a mother that's had breast cancer at age 39, for instance, they'll typically need to come in 10 years prior to when their mother was diagnosed. So those women need to start having mammograms at age 29. Typically the lower end of the age scale is 25, so whichever of those comes last. So if you've had a mother at age 35, they'll need to start at age 25 and go from there. And then there are a lot of, obviously, the family risks that you hear about pretty commonly, BRCA1 and BRCA2 genes. Those place women at higher risk, and men as well for that case. But those women will typically need to come in at a younger age and have a screening started earlier.
Very good. Are there things that I know we're scheduled women as mammograms and very cautious to make sure that we should make sure that we make those appointments and have the mammogram. How importantly as well to do self-exams as well?
Yes, self-breast exams are important. The research does state that there's a small increase in detection of breast cancers with self-breast exam. So those are still, anytime I'm working with a female that comes in for either screening or diagnostic workup, I will instruct them that self-breast exams should be done, once a month. Typically, after, try to schedule it around the same time each month when their hormone levels should be basically the same as they were the prior month, and do those. That's a very good thing to do. You don't want to do it, every day or every week for that matter, because you tend to get paranoid and maybe pick up
I was going to say it would be
that are unnecessary.
Right.
Yeah.
Right.
And then the probably more important than the self-breast exam though is the clinical breast exam, where you're going to see your physician.
Right.
And the recommendations for those currently, if you're in your 20s or 30s, you need to have at least one clinical breast exam every 3 years. And then when you reach age 40, like the mammogram, it should be done on an annual basis. So there's good research out there to say that makes a difference in early detection. And that's obviously the key in both female and male breast cancer. The earlier things can be detected, the better your outcome's going to be.
Right, right. So it sort of sounds like there's kind of three steps. One's self-exam, clinical, and then the mammogram. So I guess they all kind of go hand in hand with making sure.
Yeah, they definitely do, and we always encourage our patients to do that. Self-breast exam once a month. Once you reach age 40, again, clinical breast exam on a yearly basis, and then the screening mammogram every year. And the other thing that's important is if something is detected in between those annual, clinical breast exams or screening mammograms by either you or someone else, those patients need to make sure they let their doctor know and they can come in earlier, obviously, for a diagnostic workup. They don't have to wait the full year to have another screening mammogram done. Unfortunately, we aren't perfect. You know, they're cancers that you just can't detect on mammogram due to the density of the female breast. In females that have denser breast tissue, breast cancers are harder to detect. And so we don't always catch these, unfortunately, but on screening mammograms. So obviously, if anything's caught during the year in between those times, they need to let their physician know so they can get back to us and have something done.
Right, because things can change just in a matter of time, so that self-exams are great, or clinical as well, to go along with the mammograms. Thank you so much. We appreciate you, Dr. Johnson, being with us today. Thank you so much. We've enjoyed it.
Thanks for having me.
And I'm sorry our time's up. We've had a great time. I hope you've learned a lot with Dr. Johnson here on Lifestyles for Women, and we'll see you next time.